Hello everyone, my name is Jason Sork. I am a student of the McKendree University Baccalaureate School of Nursing. I had a presentation that was presented at my practicum site, the Marion, Illinois VA, through the Surgical Clinic Department. We had approximately 19 staff members, including registered nurses, LPNs, and also medical support assistants, MSAs. There were also the nurse manager, who is a BSN RN, and the assistant nurse manager, an associate degree RN. This presentation was related to teamwork and collaboration. What I did with visual aids is I used a poster board. I also used flyers that I had downloaded from the VA website. And I had a sign-in sheet in which I would not only be able to see how many attended, but also see, was this helpful? Furthermore, the staff received credit from the facility in that they were able to participate, which made it even more pertinent for them. The goals were explained in detail that I requested that at least participants, approximately 85%, would be able to identify 3 factors that affect teamwork and collaboration. And with that same percentage, that they would be able to identify 3 ways that teamwork and collaboration affects the work environment. And also 3 ways that they would be able to improve their communication skills. It was also addressed that after 6 months' time, that at least 50% of the participants would be able to retain this information. At the Marion VA, this topic was very pertinent. It was significant because it struck home to many of the staff. What I tried to do was make it an environment where the participants were engaged. There were some times that was laughable, but then there was times that there was a very solemn moment. I began by showing a sign of a pole that had leadership and teamwork and expressed how leadership and teamwork are connected together. I proceeded by reading off a quotation from President John F. Kennedy where he said, "As we express our gratitude, we must never forget that the highest appreciation is not to utter words but to live by them." And I went with the slogan, have you ever heard this saying, don't do what I do what I say? And then we made nursing an example about nurses need to be the examples of what that they teach not only patients but also what they expect from one another. I proceeded on with a photograph of a doctor, nurses, and a patient, and I addressed why is it important. I followed up with what the definition of collaborate was, working in a joint effort with others and cooperating with an agency with which one is not connected, and how teamwork and collaboration not only involves a direct patient care staff, such as RNs, LPNs, CNAs, but how it involves an interdisciplinary team effort through social work, occupational therapy, physical therapy, and so forth. Then, what was unique was at least 45% of the participants were mothers. And knowing that mothers are very concerned about their children, I had a picture of a girl where bullying was going on, where 2 girls were whispering to one another. And I addressed to them, the staff, I said, workplace bullying does not have to be direct face-to-face, but it can be behind the scene where you are talking about one another and how this affects patient-centered care, meaning that the staff member that is being bullied will not be able to concentrate as much as he or she could with the patient, which could result in detrimental care. I followed that up with symptoms of what a lack of teamwork and collaboration would show. I addressed about poor reporting and how shift work is very pertinent for staff to know one another, and about also staff meetings. But then I addressed that there was a loss of representation. Some staff do not feel they have a voice because of this. Other staff, they feel like there's no sense of attending. I continued on about the tension and frustration. I alerted to personal issues at the Marion VA. With me being an employee there, with confidentiality maintained, gave some perfect examples that I knew would hit home with these people. And it seemed like the personal examples really brought this to their attention in a greater way. Finally, I addressed about Joint Commission and how they stated ineffective communication is a primary cause for adverse events, and we connected that all together, how communication affects teamwork collaboration. We started in talking about how can we improve communication. I stated active listening. I addressed about how nurses teach patients and how they know when a patient's not listening, or when they have something significant happen to them and they need to talk to somebody and someone's not listening. I said, this bothers you when you see this happen, but with active listening, you comprehend everything that's going on. You are taking in everything. And it seemed that they were understanding that. I continued with 3 stars, a gold, a blue, and a red. And I said, are you a gold, a blue, or a red star? And then I proceeded on with generational differences and how that our work population has changed. For example, I gave a citing from Moore, Everly, and Bayer, 2016, how Generation X accounts for at least 50% of the workforce, and that millennials comprise 26% of the nursing workforce. Then I brought up about culture and about the perceptions, the values, and how that each generation has their own set. I did address that not everyone may fit that category, but I stated as a general rule that happens. Then I put out, what can I do? And I started in addressing ways to improve teamwork and collaboration. I started talking about resources they could use, but I also addressed available resources through the VA. I talked about ethnography, the systematic study of human culture, and how that study helps people to understand one another, how that was a useful evidence-based resource. I continued on with the Falls Action Research and how that this was used implementing a project that would improve teamwork and collaboration, and I emphasized that the findings stated that anybody could use any type of group project because that promotes teamwork and collaboration. It gets the members active. Then I continued with Team Steps followed by Crew. Now these two were resources that are available for us to use at the VA. I explained that Team Steps was a program, team strategic and tools to enhance performance and patient safety. Team strategies and tools to enhance performance and patient safety, and how this uses simulation cases to help improve how people are grouped together and how they can incorporate evidence-based strategies to promote teamwork and collaboration. I continued on about that Crew, which I used the flyers on, addressed in a patient-centered model civility, respect, and engagement in the workplace. And I gave the definitions of civility, respect, and engagement in the workplace to them, and that way they would comprehend what was going on. I also addressed that with this program that Crew states this is not going to be an acute change, but it is going to be a chronic change. Therefore, they want to make sure the team leader, the nurse manager, is persistent, that he or she is there for the long haul. What was unique were many participants did not even know about this, and they were very adamant about maybe they should use Crew. As for Team Steps, I addressed when you use a cell phone, when you play a video game, you're using simulation. And that's what Team Steps is all about. I did address the limitations of the Team Steps, how that there were questions how it would work in a non-simulated setting. But I stated that through the United States Health and Human Resource website, you can find an assessment tool that states just how ready you are to undergo Team Steps. Finally, I also addressed about what teamwork and collaboration, how the quality and safety education for nurses, Quinn said, had a project that agreed that identifying teamwork and collaboration, it is a required competency for nurses to attain this in order to improve the quality and safety of the healthcare systems with which they work. I also talked about AONE, the American Organization of Nurse Executives, and how that they are recommending nurse managers have this as competency to provide relationships management and influence behaviors. And also the Institute of Medicine, IOM, and how they recommended to expand this in order to improve collaborative improvement efforts. And that it should occur between nurses and other members of the healthcare team. As we continued on in this presentation, I also addressed a significant moment in history, being that 49 years ago was the assassination of Dr. Martin Luther King Jr. and how then Senator Bobby Kennedy was in Indianapolis, and he was recommended by then Mayor Richard Lugar not to say anything for fear of hostility. But I stated, Senator Bobby Kennedy stated, no, I'm not going to do that. I'm going to address this up front. And he spoke with them, addressing how he felt related to his brother's assassination. I concluded stating every metropolitan area that was affected by the Civil Rights Movement, that one city, Indianapolis, did not have any hostility. I said, furthermore, just as Senator Kennedy did that, you and I can change things. We can prevent hostility from occurring. We can make a difference. It hit home with them. I know that many times I stated with presentations, you are solemn, you want to make everything, how should I say, as professional as possible. But I found with the loose atmosphere, using personal examples, it gave me an aha moment. It made it real with these staff. Would I improve on anything? The only thing that I worried about is I had a moment where I started the presentation and a patient came in. I had to adjust the timing of that presentation for a moment. My tongue did get a little tongue-tied, as we could say. And with that, I had to regroup my thought process. But as for anything else, I can safely say that everything really reached out to the staff. They understood this. What was also pertinent that I felt was beneficial was they knew me, and they knew that I was an employee. I tried to make a fine balance between work and the presentation, because I stated, even though I'm an employee of the VA, I am representing the McKendree School of Nursing. And through that, I feel like this presentation was an educational tool which even the nurse manager had stated she felt like this was what they needed, because they had had a perplexity regarding generational differences and a lack of teamwork and collaboration that was affecting. One thing I do want to add, I brought up about CPR and how the number one intervention that we are taught to do prior to engaging with the patient is to look. I stated, this is what we need to do as nurses. We need to look at our work environment and see, is this safe for us, or should we do something about it? And basically, I can safely say that with the flyers, with the poster, with what was said, I really believe that it really brought a sense of reality of this subject. It changed me in a way, because I felt like not only was I representing the McKendree University, but I felt like I was also being a nurse advocate to try to promote teamwork and collaboration. This was a very significant aha moment for me as well. And I thank the McKendree University for having this opportunity to address this. Thank you.